Senator Lankford.
Mr. Chairman, thank you. Dr. Fauci, thanks for coming today. I know you're invoking your Fifth Amendment right, which you have the right to be able to do constitutionally, but thanks for coming and be a part of this. There are a lot of issues and a lot of questions that have come up, and hopefully in some day in the future, we'll be able to get all this clarity to be able to pull together. There were over 1 million Americans that died from COVID. You know that well. You were tracking the numbers literally every single day, those affected and those that died from the earliest days. There are a lot of lessons that we've got to learn from this, that we should put into history to be able to determine what happens in the future. How do we respond in the future? How do we deal with something like this again? It was uncharted territory for everyone. But I would tell you, countless families, including my own, watched a loved one die behind glass or through a screen because we couldn't get access to them. Children couldn't get to school. People missed their prom or graduation ceremonies. There were lots of things that happened that dramatically changed the future of the country. The mental health issues that we have continued to deal with from the isolation have been profound. Even something as simple as children that wore masks or around adults wearing masks for all that time are slower in learning language now because they couldn't watch someone's lips moving, and so they're slower in that. Amazingly enough, churches and places of worship were forced to be closed down. There were even churches that met where the pastor preached in the parking lot and the congregants all met in their cars with windows up, and police came and scattered them and said, "You can't be here." The simple act of social distancing became an issue. As everyone guessed, what's the right distance to be away from someone else? Literacy rates have declined. All these things are results, not to mention the loss of lives and the health experiences that have been out there for many Americans. So there are legitimate questions. I wanted to be able to raise some of those, to be able to walk through some of this, because it has been very, very challenging. As we've gone through some of your notes and your diary and other things that are out there, we're trying to be able to pull bits and pieces of things to be able to learn lessons. On May the 6th, 2020, you wrote at that time, I had a conversation with Robert Redfield, who, as you know well, was then the director of CDC, about the fact that greater than 1 million children worldwide have missed their measles vaccination because of the shutdown. You stated, this is terrible and needs to be addressed, since on that basis alone, there would be far more excess deaths from measles among children than coronavirus deaths among children. I need to bring this up to the TF, the task force. Did you ever have an opportunity to bring up the potential of measles deaths among children and an infection rate going around the world from measles based on the fact that so many children would not get their measles vaccine because of the shutdown?
I'm sorry, Senator, but on the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
That is your right to do. One of the big issues that's really coming up is on the lab issue. This was greatly discussed about whether this came from a lab or whether this came from nature. There are obvious issues and differences between the two to be able to know this. You had a lot of conversation on this. Scientists around the world were in conversation on this. There were different statements that you even made in your private notes and your public notes on it. In January the 26th of 2020, this is before we had our first tragic death of coronavirus in the United States, you wrote, it now appears using epi data that the genomic data, the first infection was in early December and was not connected to the market, which was the big rumor that was out there, was this wet market in China. We know the market was not the source, it was the amplifier. On January the 31st, you wrote about a phone call. You wrote the people on the phone felt the mutations around the furin cleavage site of the spike protein could not have occurred naturally, since it would require an evolutionary jump that they found nowhere in bat isolates. They bring up the possibility this could have been deliberately inserted and either accidentally released or deliberately released by a crazy person in the lab, the former being the most likely. February the 1st, same year, 2020. This is again still before our first death. There was not total agreement about the likelihood of deliberate insertion. Ron said he was sure that this could occur naturally, and we should not waste our time and divert our effort to pursue this. This is expected of him since he was the original gain-of-function person with Yoshi. Also, Christian was with Ron. The rest felt deliberate insertion was possible, and given the fact that Dr. Jingling Shi at the University of Wuhan has been working for years in gain-of-function in coronaviruses to allow adaptation of the spike protein to bind to the human ACE2 receptor, we could not let this go. That's a remarkable statement for February the 1st of 2020, when there hadn't even been the first death here, but we knew something was moving. You knew well that something was moving. You identified February the 1st before any of us had ever heard of the Wuhan lab. Not only the Wuhan lab in the conversation, but literally the scientist that you named in your own notes, the lead scientist that was there. It's interesting to me on that, and the questions I was going to ask you was just your background and knowledge about the Wuhan lab and Dr. Shi and all the details. I'm aware of where you have been on trying to be able to plead your Fifth Amendment right, which is your right to be able to do. But I also wanted to be able to find out some facts to be able to help us for the future on this. The Lawrence Livermore National Laboratory in May of 2020 put out a classified document that has only been recently unclassified on this, that had this statement: we assess all the necessary conditions for an accidental release of a laboratory-modified coronavirus, specifically a coronavirus adapted to recognize human cell receptors, were present at the Chinese Wuhan Institute of Virology in mid to late 2019. Now, the question that I had for you is, this is May the 27th of 2020. This is the report that most people will see, is this. I have clearance. I serve on the Intelligence Committee. I've actually read this complete document unredacted. My concern is, were you given the ability to see this document unredacted? Based on your position, were you able to see this and to be able to get this information? I could see it, and I know what's here. Everybody else just has their conclusion at the beginning of it, not this. My question to you was going to be, did you have access? Because it's important for the future that people in your position do have access to this kind of information and insight. Is there any way you could answer that question? Were you able to give access to this data?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
You wrote on January the 26th of 2020, we should be allowed to send our CDC epidemiologists to China to work with them so they could see the data firsthand. You also wrote in February 12th, 2020, that you had great concerns about the World Health Organization because it depends greatly on China and, as you stated, often bows to them. Now, this is a really important issue that we've got to resolve for the future. It's not just our cooperation with Chinese scientists, it's our acknowledgement that China covered up their data, wouldn't allow our scientists to be able to come in. They cleaned up the wet market. They cleaned up the other areas. They wouldn't allow you to get access to all the other scientists who are there, including their health records, what happened to them, or even all the sequencing that they had done in advance. For the future of our research and our cooperation with any scientist around the world, I think it's really important that we resolve, if we're going to fund research and cooperate with you, we've got to have certain things from you. If things go sideways, we've got to have access to all information in all places. You were noting not only that China was affecting the World Health Organization and that China was bending them to their will, and so the World Health Organization was putting out data that you saw, at least at that point, as being from a Chinese perspective, covering up what was going on, but you also noted we weren't able to get access to all this information. We've got to be able to figure this out for the future to be able to make sure that research that is done, we have access to all information if something goes sideways at some point, which clearly it did at the Wuhan Institute of Virology, and that being, as was noted by many people, the only lab in the world that was doing research like this that had a lower standard of actually their security standards there than many other labs around the world, yet they were doing this very dangerous research. What can we gain And what advice could you give us to say, in a future setting, we've got to make sure that we actually get information from people and we can be guaranteed that we're going to get that insight? Yes, sir.
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
I yield back.